name is Brittany.
Hi.
I'm going to be your student occupational therapist today.
Okay.
So I heard that you had an injury to that right elbow. Is that correct?
Yes.
Okay. So today I wanted to come in and just teach you something you could do to decrease that pain and swelling. And I know you had some trouble with washing your hair and doing some activities like that.
Mm-hmm.
So I'm going to teach you just a quick and easy thing you can do a couple times a day so you can get back to doing those activities, and then maybe you won't have as much pain with them.
Great.
So first thing we're going to do is we're just going to ask you a couple questions just to make sure that we can do this ice on you. So can you tell me your name?
Gabby.
Can you tell me what year it is?
2016.
Okay, and can you tell me why we're here today?
I injured my elbow, and you're going to show me something to kind of relieve that pain.
Great. Now, some other questions. Have you ever had a rash with anything exposed to being cold?
No.
Okay. And have you ever been diagnosed with something called Raynaud's disease?
No.
Okay, what about told that your fingertips turn white or blue or anything?
Never happened.
Cold. Okay. Any other reactions to cold that you've had that
No.
have been okay? Have you ever been diagnosed with something called cryoglobulinemia?
Never heard of it.
Okay.
So no.
And have you ever been told that you have some circulation issues?
No, never.
Okay, great. And have you ever had any recent problems with a nerve being cut?
No.
Something like that. Okay. So now I just want to take a look at your skin real quick. There's no wounds or anything, so that's good. If you had a wound in that area, you probably wouldn't want to do the ice over there. And then I'm going to just run my fingers along your arms, and I want you to tell me if it feels the same on both sides.
Okay.
Does this feel the same?
Yes.
Does this feel the same?
Mm-hmm.
Does this feel the same?
Yes.
Okay, great. So, now that everything checks out, I'm going to go ahead and kind of teach you how to do this on yourself.
Okay.
Okay? So, the first thing I want to go over is the stages you're going to go through when applying the ice.
Okay.
So, there's an acronym called CBAN.
Okay.
That's going to kind of help you remember the stages, and I'll have a handout for you as well after we're done.
Okay.
But C stands for cold, B stands for burning, A stands for aching, and N is for numbness. Okay?
Yes.
And once it becomes numb, we're going to go ahead and stop. That's when you want to stop doing
Okay.
ice. There is a small risk for frostbite with this treatment, but we're only going to be doing it for about 5 or 10 minutes, and we're going to take it off again when it becomes numb, so that risk is really low.
Okay.
Now, does this sound like something you want to learn?
Yes.
Okay, great. So the first thing we're going to do is we have you positioned correctly. We want your arm a little elevated and just on some towels so that water doesn't drip off.
Okay.
And then we're going to go ahead and cover you with this when we start. So you're going to want to do it on a 6-inch area, and you're going to want to avoid your elbow, and then there's also a small bone up here.
Okay.
You're going to want to avoid just because we don't want to do it straight on the bone.
Okay.
Okay? And we're going to start by ripping the cup. So if you want to do it with this one, you rip from the top, and then you want to leave about a fingernail worth of ice showing. You just want to rip all the way around. Perfect. Okay, great. So we're going to go ahead and use the one that I did. But see how there's about a fingernail worth of ice showing?
Yeah.
And then you want to go ahead and rub the edges
Okay.
to make sure there's not any hard edges.
Okay.
And then we'll go ahead and cover your arm. So you can just make kind of a swoop around your arm just so that, again, that water doesn't drip everywhere.
Mm-hmm.
So I'm going to go ahead and do it first, and then I'm just going to have you do it as well. Okay? And we want to remember to watch out for those stages and not get over those bony areas. So you just want to do it in small circles, like that. So if you want to do it. Great. Okay, that's perfect. So, do you have any questions?
No.
Okay. I'll go ahead and wipe you off. And then you might have just a little bit of redness around the area when you're done. That's completely normal. That should go away in about 30 minutes.
Okay.
If it does not, then you probably want to notify someone because you could be having an adverse reaction to it.
All right.
Okay?
Thank you.
And here's your handout.
Okay.
So you can go ahead and read that if you have any other questions.
No.
Let me know.
All right. Thank you very much.
Thank you so much.